Hey, I'm Andy. In this video, I'm going to be talking about my experience with getting misdiagnosed with bipolar disorder while experiencing a personality disorder. So, if you're interested in hearing what my experience was like being misdiagnosed for bipolar, then stay tuned. So, basically, when I would say I was around 19. I had been taking Lexapro, which is an antidepressant, for a pretty long time since I was 12 years old. And that was because I had been diagnosed with depression when I was really young, I think 11 or 12. I also had an eating disorder when I was younger, so they had put me on the Lexapro to kind of help out with that. So I had been on Lexapro for a long time by the time I was 19, and it wasn't working for me anymore, which is typical. I mean, it's typical for an antidepressant once you're on the highest dose. After being on it for a while, it's typical for your brain chemistry to just kind of be used to it. And so that's kind of just what happened. So I went to a psychiatrist, and my first visit with them was to just let them know, like, hey, like it's not working like it used to. And so I just explained that. Paid a lot of money for that visit, and really ended up being just 5 minutes. Well, I'd say 15 since it was the first new patient visit. So on this new patient visit, she said, okay, well, we'll try a different antidepressant. So that was fine. I switched my antidepressant and we tried a different one. Didn't work for me, which is typical. I mean, you just have to find the right one for you. So it didn't work for me. It was causing my depression to worsen. So I then went back to the psychiatrist again to advise her that this medication did not work for me. And she asked me more about like what was going on. Like she kind of went deeper into it to ask me like different questions so she could diagnose me. And I would later find out she was trying to diagnose me with bipolar disorder. So she was asking me all these questions, and it is true that I go through periods of mania and depression, but my cycles are very, very, very frequent because, as I know now, I have borderline personality disorder, and it's a disorder of the actual personality and the thought processes instead of the actual chemical balance and makeup of your brain, because bipolar disorder is a chemical imbalance just like depression is. It's a chemical imbalance. You take a medication and it really does help out. Obviously you wanted to go to therapy and everything like that, but you can treat the chemical imbalance. With borderline personality disorder, it's different because it's a disorder of the thought process. It's not a chemical disorder. So she, based on me saying like what I was basically like having these crazy episodes of, not being in control of myself, disassociating, which is basically not being aware of your actions or thoughts, kind of just feeling separate from your body, which happened to me. It still happens to me pretty often. But one time I ended up in a really high manic episode. I ended up shaving half my head. And so I was like, you know what? Like, I need to go talk to her. So her seeing that I was going through the manic episodes, and then I would have the episodes of depression where I would be in bed for a week and not even get up to brush my hair or brush my teeth or anything. She diagnosed me with bipolar disorder. Now, this diagnosis took about 15 minutes. She didn't run any tests or anything like that. Nothing like that. She just basically gave me the diagnosis based on what I told her, and then she was like, you know what, we're going to start you on a mood stabilizer. So I was like, okay, I've never tried it before. Let's do it. So she put me on the mood stabilizer, and I always want to give it a chance because I know that with psychiatric medications, you really do have to give them a chance to work. You can't just throw it out and be like, oh, this isn't for me in the first few days, because they're going to cause side effects. I mean, every single one of them will cause side effects when you're first starting it. So I knew this because I had the experience of these medications with antidepressants. So I understood that. So she gave me the first one, and I was on it for about 2 weeks, and I started having even more intense manic episodes where I didn't remember anything, like major amnesia. Like I think back to those times, and my ex would tell me like, you did this and you did this and you did this, and I don't remember any of it. So I went back and was told, okay, let's switch you to this antipsychotic. And I was like, okay. You know, like I wasn't expecting I needed all this. Now, also keep in mind that there was no talk of like therapy or what options as far as like talk therapy or other coping mechanisms. It was just medication, 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 medication. So that was really what I was dealing with. And they were making a lot of money off me because at the time I did not have health insurance. And so it was all out of pocket. So I'm sure anybody who's been to a psychiatrist knows that psychiatrists are not cheap. I mean, it was, for me, it was $150 a session. And I was going once a week. So however much that is a month, I'm not good at math. But I mean, over $500. So, yeah. And that's not including the medication. That is simply the office visits to diagnose and follow up. Because with a psychiatrist, when they give you a new pill, they want to follow up the week after. And if that pill doesn't work, they want to follow up the week after that. And it just becomes a consistent thing until you find the right pill. So I was doing that for a while, and then I was paying out of pocket for the medications. And as the medications got more intense, like we were done with the antipsychotics and all of this stuff, I mean, it got more expensive. Where, I mean, I was basically spending all my money on the psychiatrist, and my mental health was suffering. I mean, suffering to the point where, I mean, it destroyed my relationship completely. I don't want to completely blame it on that, but, excuse me, sometimes I still sneeze. I have a really long-haired cat. Her name is Paisley. Sometimes she still makes me sneeze because, you know, she has a lot of hair. So, I'm okay though. But, it got really bad. It destroyed my relationship. And I say that because I don't want to blame it on one thing, but I do know it greatly contributed. Because, I mean, I took from valproic acid to lithium to, I mean, you name it, I've taken it. I was on Klonopin, which Klonopin really helped with my anxiety, but a lot of these drugs became really addictive, and I started, you know, having trouble with getting off of them. So, or not, you know, being like having to take more and more and more and more. So it was really bad. And we had gone through at least 5 or 6 different antidepressants, and then we tried like a few mood stabilizers. But the mood stabilizers, I'm very sensitive to medication, so I would get these rashes, and it was awful. So I ended up in the ER for these rashes that I got from the side effects of the medication, and then I end up having to pay for that and going into debt because, I mean, I was in the ER at least 4 times for medication side effects from trying these new pills. So I don't even know how much money that is. So, I mean, and the antipsychotics, they're just getting more expensive. So we tried, I think it was 13 total that I ended up counting was 13. And that was within a span of 3 months. And that's why I'm saying that the place that I went to, I don't believe that they were ethical and they actually followed the correct policies as far as like how quickly do we switch the patient around on medication. I don't think they weaned me off properly, and I don't believe that. I think they just switched me around too much. Like it messed me up to a point where I was violent, and I was never violent before. I mean, I've had outbursts, major anger outbursts, but I was violent to a point where I was separate from my mind. My mind was here and I was here, and they were two separate things. So it got to a point where they were giving me lithium. And the daunting thing about lithium is you have to go get your blood tested for it to keep taking it. Because if your lithium levels get too high, like that's really dangerous. And so I started taking it for about a week. And I was on my way to this job interview, and I took my lithium. I was taking it for about a week and had this migraine where I couldn't see out of one eye. So I ended up going to the ER. Lithium toxicity, or however you say it, is what they told me I had. And I was like, at that point, I called my psychiatrist, and I was like, you know what? This is number 13. I don't know if I want to continue this. And they were like, oh, it's okay, we're gonna give you this. And I was like, when is this gonna stop? When is this gonna stop? And when are you gonna stop taking my money on top of that? Because it's not only you're throwing all these pills in the mix, this cocktail, brain chemical cocktail, but you're taking all my money in the process and it's going down the drain because nothing's working. So I ended up quitting cold turkey because I felt like that was the smart thing to do. I mean, I don't see who in their right mind would put up with the way the psychiatrist is treating it. And at no point did anybody question, is this diagnosis correct? And did we take the time to actually understand her on a deeper level rather than like, oh, well, let me see you for 5 minutes and let me match you up with the right pill? Like, no. Because 2 years ago, I had been off all the medication because I had quit cold turkey. And I went to therapy because obviously I was having issues. And so I went to therapy, talk therapy, and I had a therapist get to know me. And after about 3 weeks with her, which she took her time, 3 weeks, she diagnosed me with borderline personality disorder. And that was when it all clicked for me. I explained to her the misdiagnosis of bipolar, and she's like, oh no, you're not bipolar. You know, they can't just say something sounds similar and just throw a label on it, because that's a dangerous label. That's not a label to mess around with. These aren't medications to mess around with. Some of these medications are more dangerous than street drugs. And I do firmly believe that my memory has suffered somewhat from the amount of medications I was taking and the rapidness of changing them, because there's a good chunk of 2016 and 2017 around that time that I don't remember. Like, I don't recall, and my ex has to tell me like what went on, because I can't recall it. I think I was just in a severe dissociative episode, either because of the medication or because it was just hell. No one was helping me. No one was really trying to get to the root cause of like what's going on. And then finally, I'm years later, it's 2020 now. So I think I actually got my diagnosis 2018, so it wasn't that too long after it. But when I got that diagnosis, I was like, wow, that explains a lot, because there's a huge difference between borderline and bipolar, because borderline, again, like I said, is a disorder of the thought processes, whatever you want to say. I'm not a medical professional, okay? But it's like a disorder of it's a cognitive disorder, okay? Like the way you process things and the way that you have interpersonal relationships with people. And they can be very turbulent. And the way that you respond to stresses in life and different things, like, that's borderline. And bipolar is something completely different. And it's something where I believe that you're born with it. Like, you can look at someone's brain that's bipolar and you can see the difference. Like, I've researched that, and it's something where the medication does help, but obviously you do need the therapy too. But medication like the ones I was taking would help somebody. But the reason it wasn't helping me is because I never had a chemical imbalance in my brain. I had a disorder of the personality, a disorder of the thought processes. And I believe that my borderline has been the root cause of all my other issues. I mean, depression, anxiety, eating disorder, all that. I feel like it's the root cause, and now that I know, what it is, and I'm going off that blueprint, I can better make decisions for myself, and I know what I need, and I no longer rely on a psychiatrist to tell me this and tell me that. I do go to a psychiatrist. I tell them exactly what I need to take because I know what works for me. And other than that, I go to talk therapy, and I research a lot about borderline and how to live with it and how to function in society and how to form relationships that are lasting, how to form lasting connections, such as like career growth, because it's very difficult with borderline. So anyways, I just kind of wanted to explain my experience with getting misdiagnosed with bipolar and kind of what the difference is between bipolar disorder and borderline disorder. So thank you for watching this video. I appreciate it.